We are going to go to 1 minute past, and then I'm going to introduce you, Anna.
Thank you.
Do you know what? I think everyone's on their lunch break, so we are going to kick on, and I will admit people as they come in. Hi everyone, welcome to Joint Dynamics Evolve, first of our Lunch and Learn series. We're really grateful for you all spending your lunchtime with us, for joining us from work or from home or from wherever in the world that that you are. We're really happy that you're here with us. We are today talking about birth prep, and we have the very esteemed Anna with us. Anna is a senior women's health physiotherapist with us at Joint Dynamics Evolve. She has many years of experience, has her own birth story informing her evidence-based practice as well. I don't want to take up time. I want everyone to feel like they can throw questions into the chat that I'm going to monitor, and we're certainly going to get to those as well. Anna, I'm going to pass directly over to you and start with the obvious. Can you tell us a little bit about birth preparation?
Sure. Thanks, Sharlene, and welcome everyone. The notion of birth prep really is how can we physically prepare your body in the lead up to the goal to have a vaginal delivery. And that the concepts that are involved in that are creating space through the tummy and the pelvis, helping the pelvic floor muscles to lengthen and relax. We can teach you effective techniques for pushing. What are the different options for positions to labour in? What are non-medical forms of pain relief or distraction techniques that you can use? And also, how can we get your birth partner involved? So it's quite a wide topic, but we feel that women's health physio is a really important person to have in your antenatal team, particularly throughout your third trimester and then into fourth trimester. Yeah.
I think you're muted.
Sorry about that. I'm just continuing to add.
There you are, Sharlene. You're back.
Just continuing to add people as well. Okay, so a women's health physio can help with the preparation for getting me ready for a vaginal birth, if that's my intention. What about if I'm having a C-section, a planned C-section? Is there a role there?
I think there's definitely a role in terms of a cesarean section. Obviously, we're not preparing your pelvic floor for delivering through the baby through the birth canal, and we're not teaching you specific labour positions, but we definitely have a role to keep you active and moving, feeling healthy in your own body throughout your pregnancy and third trimester, and then informing you with lots of information about how to look after yourself in those early days and weeks after surgery.
Okay. Okay, so one of the questions that we received prior to today was about perineal massage. So what is it? Should you, how do I do it? Can you explain its sort of role and what a women's health physio can help me do with that?
Sure. So perineal massage is a technique that women can start from around 34, 35 weeks pregnant once they've checked with their obstetric provider. And the idea is that you start doing some massage and gentle release work of the pelvic floor muscles that sit closest to the outside of the pelvis. The concept behind perineal massage is it helps, number one, to desensitize the area. So you start to get used to what the sensation is of pressure and stretch around the perineum. So that's not a foreign feeling for you as baby's head starts to crown. But also it helps to start to soften those pelvic floor muscles that need to drop, relax, and open for baby to be delivered. Would generally suggest that we want you doing it every second day and for about 5 minutes in total. And you've got options. Some women like to do it themselves and that feels best for them. Realistically, you're going to have quite a big belly by 34, 35 weeks pregnant. So some women have a little bit of difficulty actually reaching around their tummy down to the vaginal entrance to do this massage technique. You're only inserting your thumb or your index finger about 3 centimeters into the vagina, but for some people that's tricky to reach. So they might ask their partner to help, or other people say, no, I would actually prefer my women's health physio to do it, and we can get you to come into the clinic and we will incorporate perineal massage as part of your birth prep appointment. I would always suggest make sure that you have a chat with your obstetric provider or your women's health physio before you launch into it so that you understand what the correct technique is and the reasons behind it.
Anna, do you have any sort of clinical information on perineal massage? What do your clients sort of say about when they start perineal massage and perhaps the effect or their perceived effect on their birth story?
I think a lot of people initially, when we bring up the concept of perineal massage, are a little bit shocked or slightly nervous by it, but it's a skill and it's something that once we start practicing it, it starts to become easier. And you've got your physio to talk through that technique with you and touch base with you throughout your third trimester, that late third trimester, so that if you do have any questions or concerns, that we can guide you through it. I think from a women's health physio point of view, there's such great benefits. We've got really great research to suggest it can reduce your risk of severe perineal tearing. So that's a 3rd or 4th degree tear, around a 40 to 60% reduction of tearing down towards the back passage. Can reduce your risk of fecal incontinence, so having difficulty controlling your bowel motions postpartum by around 70%. Can reduce your risk of general pain in the area, your need for an episiotomy, so that's where the doctor might need to make an incision to make more space through the pelvic floor muscles. So there's great benefits to it. I understand the hesitation initially, but if someone teaches you so that you feel confident in knowing what you're doing, know that this is something that you can be really doing proactively to help your how your pelvic floor may work during labour, but also your outcomes after delivery.
Okay, so I've had a couple of babies vaginally and one through C-section, and some of the stuff that I've learned from the women's health physios at Evolve is amazing, and I want to make sure that we get to all of that today, Anna, for all of the people on the call. Can you talk to me about the positions of labouring in? Because I know that there is that sort of traditional on your back in the stirrups sort of labouring, that perhaps we are sometimes convinced to go into that. What do some of the research say? What do you see in clinic, and how can a physio sort of inform us on all that sort of thing?
Great question, Sharlene. You're right. I think a lot of women, before they have any form of antenatal education, will have an image of, probably like in the movies, that they would see a woman lying flat on their back pushing. What we want you to know is that throughout your labour, and when I talk about your labour, I mean not only the first stage, which is when your cervix is dilating and you're having those contractions, but also the second stage of labour, which is when you're actively pushing to deliver baby. You don't actually have to be lying on your back. We can have you in standing, we can have you in forward leaning, you can be in 4-point kneel, you can be in sideline. We can use different equipment like a Swiss ball or a peanut ball, or get you in and out of the bath or the shower. And the notion is that as much as possible, we want to use gravity to help with baby descending down through the pelvis, through the birth canal, because we know that upright positions tend to lead to a faster labour.
So what about when it's time to push? So if I have not had a child before, I know that the concept of a baby leaving your body, it's quite sort of difficult to get your head around almost. How do I push a baby out?
Yeah, I think it's a learned skill, to be honest. We need two things to happen for you to be able to push your baby and deliver your baby vaginally. The first thing is that you need to create intra-abdominal pressure through using your breath. And we want you to be able to direct that intra-abdominal pressure down towards your bottom and your vagina. The second thing that needs to happen is that your pelvic floor muscles are almost like a door that opens and closes the outlet of the pelvis. So those pelvic floor muscles need to drop, relax, and open as you push. So they're two key things that we look at in the clinic as part of a birth prep appointment to see whether you can do that or whether you might need some help, some tips and tricks to learn that skill. We know that around 30% of women, when we ask them to drop, relax, and open their pelvic floor, actually contract and tighten their pelvic floor in the opposite direction. So it's not uncommon to see that in clinic, and your women's health physio can help you relearn that movement pattern. Apologies, they can help you learn that movement pattern before you go into labour. Also keeping in mind that you're not the only one using your breath and intra-abdominal pushing, in that your uterus also does that as well. Your uterus, your cervix will contract, and then your uterus will help to push baby down through the pelvis as well.
So we've got a couple of excellent questions here. So Anna, one of these questions is regarding epidural and things like that. And we know that you are not a doctor. Your position as a physiotherapist is the lead up and preparation. But perhaps just to speak to some of these questions, just with your experience of clients. So one of the questions is, are there some positions of labouring that you cannot do with an epidural? And in your experience for birth stories, do hospitals turn off the epidural? I think we all just froze a little bit.
Oh, we all froze? Okay, hopefully we're back.
So did you hear that question, Anna?
I heard you were starting to talk about epidurals.
Yeah, so are there any positions in your experience that that we can't do when we have an epidural, if we make that decision now or in the lead up? And do hospitals tend to turn the epidural off when it's time to push? Like, how will I know what's going on if I have that epidural?
Yep, so the epidural, a lot of women will start to find that you might hear the concept online, or your friends or mothers groups starting to talk about a walking epidural. So epidurals used to be quite dense in nature, and what we mean by that is they really affect the ability for your muscles to work, so therefore your ability to get up and move around the bed space. Epidurals these days, or walking epidurals you might hear, tend to have less of effect on the ability for us to move our legs. So women are generally able to be a little bit more active throughout their first and second stage labour. For some women, they might be able to walk around the bed space, as the name walking epidural implies. Other people might find that they don't have the ability to do that. So they might still be able to roll onto their side, for instance, in bed with some assistance, or they might be able to get, some women might be able to get into more of like a forward lean position with the help of their partner, the midwives, that kind of thing. But it really depends on, I guess, the type of epidural you have and the way that your body responds to that epidural. So if you are considering an epidural and think that you might want to be able to be more mobile throughout your labour, that's definitely a conversation to have with your obstetrician in the lead up to your delivery, and then also your anaesthetist on the day. Women, if you come into clinic for birth prep appointments with us at Joint Dynamics, and we know that you're planning to have an epidural, we might spend a little bit more time going through positions such as side lying and how you can use different equipment and props in side lying for labour compared to positions where you might be walking or standing and supported, just so you know what your options are depending on how much you can move your legs. Did that answer the question?
Yeah, I think it did, mate. I think it did. Okay, so the other question that we have is, are there some positions that tend to have a better result in terms of women tearing and things like that? Is there a sort of a consensus or an understanding?
We think generally side lying is a great option. 4-point kneel can be a great option to deliver your baby in. We know that positions where you're lying flat on your back doesn't allow, we're not using gravity to help baby descend down through the pelvis, and at some stages during your labour, the tailbone or the coccyx is fixed to the bed. It's not able to move and therefore create more space through the pelvic outlet. Now, by me saying this, I'm not saying do not lie on your back during labour. I definitely lay on my back at certain stages throughout my 2 labours, and that was the best decision for me at that time. And your obstetrician or your midwives might have specific reasons why they feel like that's the best position for you or your baby to be delivered in or for you to labour in. But just know that you don't have to be lying flat on your back if it's not medically indicated by your team. You've got other options.
Hannah, in your time working in Hong Kong, does the see for doctors and deliveries want you to lie on your back?
Could you repeat that for me, Sharlene, please?
Sorry, in your time in Hong Kong and dealing with mothers in Hong Kong, is there a tendency for those birth stories? So one of our participants is sort of saying, do they sort of tend to encourage you to lie on your back rather than be up and about, because it does sort of tend to be easier for the team in the room?
No, not necessarily. I've had plenty of clients I've worked with and my own friends and my own birth stories that women laboured in all different positions, whether that be on your side, standing up, sitting on a Swiss ball, on 4-point kneel, lying on your back on your side. So no, I don't think there's a specific trend in Hong Kong from my own clinical experience.
Well, that's good to know, because I think that sometimes we get all of the worst stories, right?
Yeah.
Around that. We get all of the worst stories.
And that's something, I'll just jump in quickly. That's something, again, when you are talking to your obstetrician in those final weeks before delivery and you're discussing a birth plan with them, bring up a conversation about labour positions with them and what are their thoughts on it for you specifically and how you're presenting, and how can they support you in your wishes throughout that labour process.
Which I think brings us nicely to one of the questions again that we received before today. What about the other person in the room, your birth partner, birth partners, depending on how you're doing this? What is their role in the lead up to labour and delivery? What are they doing for you during that time? And how can a women's health physio help inform that to make it a really supportive environment?
I think birth partners sometimes feel a little bit helpless. They generally want something to do, and they want specifically to know how they can help in that process because they want to be involved. So we try and encourage birth partners to come along to appointments, our birth prep appointments with you in clinic, and we will talk about lots of different things. We will go through different positions that you can get into in first and second stage of labour with the help of your birth partner, and some of those birth positions are better done with a partner compared to a chair or a wall, for instance. We'll talk your birth partner through different massage or acupressure techniques that they can use during contractions to help with either distraction or pain management. And we'll also talk to you and your birth partner about the importance of hormones during labour. So we know that we want lots and lots of oxytocin, your love hormone, during labour, because that helps to promote that labour progressing. And the way that we can produce lots of oxytocin is by feeling safe and secure and loved and supported. So that's such an essential role for your birth partner during that time, to help facilitate you feeling that way. And that might be through physical touch, it might be through different affirmations or words that they're speaking to you, or it might be that purely they make you feel safe in that birthing space by being in control of things that they can do, such as the lighting in the room. Do we want bright white lights, or can they know how to work the light switch so that we dim the lights to encourage you to feel safe and calm? Can they know how to work the bed mechanics so they can put the head of the bed up or make it higher or lower so you're not trying to fiddle with that during a contraction? Can they feel confident in knowing where the midwife bay is, so that if you do need some input and your midwives aren't in your room during labour, they know how to get there and how to get help? They're your greatest advocate during labour. So at some stage, for some women, they might not find that they are able to verbalise what they want. And by having a conversation with that birth partner before you go into labour, they can help during times that might be a little bit more difficult or challenging as well. You're a pair and a team in that process.
And I think it's really interesting. I had my youngest son in the public hospital system here in Hong Kong, and I actually had him by C-section, so there was no labouring involved. But on the ward, there were women going through labour, and some of the visiting hours can be quite strict, even if you are labouring. If you're not in the birth suite, once you're in that birth suite, obviously, that's an entirely different story. Can you talk us through what sort of information a women's health physio can provide to empower us through those early stages? If perhaps that birth partner's not there, what's the type of information you can give people?
Yeah, great question. I think we want you to feel confident in knowing, one, we've talked about labour positions that you can do with and without your partner. So you've already practiced them in clinic with us, so you feel confident in that process once you go into labour. But two, knowing different distraction breathing techniques and pain management techniques such as a TENS machine, so that you feel like you can make the best decision for you at that time depending on what sort of pain relief you want. So again, in clinic, we will go through lots of different distraction techniques with you to try and figure out what works for you. Because, for instance, Sharlene, for me, I know that breathing and counting really helps to distract me from pain, but that might not necessarily work for you. So for you, it might be tapping, for instance, or focusing really specifically on an object and analysing it throughout that process. So we'll try and work out what works for you, because that's going to be different to me. And the other thing that I mentioned earlier is some women really like using a TENS machine. Have you ever heard of that before? Yeah. So a TENS machine is a little portable electrical device that you hold, and then it has leads with sticky electrodes that we place 4 on your back. These, when you turn the machine on, it sends electrical impulses up through your spinal cord into your brain, and it affects the ability of the brain to receive and interpret those, I guess, those pain messages that are coming from the contracting uterus. So it can be a really great form of non-medical pain relief that you can put on as soon as your labour initiates, and you can be mobile and active with it. And as long as you're using it as per the instruction manual, and your physio will talk you through how to use it safely, there's great benefits for you. So that can be hired from Joint Dynamics Evolve in the lead up to your labour. Some hospitals will also have a TENS on their birth suite so that you can use it once you get to hospital. But we actually know there's some great benefits putting it on fairly early in labour, because it also helps your body to release its natural form of opioids, so endorphins and enkephalins, and that takes a little bit of time for those hormones to build up in your system. So that's why we want you putting it on early in your labour, compared to, for instance, when you're 7 centimetres dilated and really needing something to help at that stage. So keep that in mind as well.
And I think that the learning how to push thing is really counterintuitive, right? We sort of have this image that our bodies will know what to do when the time comes. I'm interested to hear from your experience, or perhaps from some of your clients and stories about them, about how do I learn how to connect all of those things? Isn't my body supposed to do this? You know, women been doing it for thousands of years and all that sort of stuff.
Yeah. As I mentioned before, I think it can be a learned skill, because for about a third of us, we're not actually coordinating that correct movement pattern of your pelvic floor muscles dropping, relaxing and opening as you bear down and push. I've had a client recently actually tell me that she had an epidural, which we knew was the plan, but she had come for her birth prep appointment to see me from 32 weeks onwards, and we had been practicing the concept of pushing. We had used different cues, like verbal cues, visual cues, so she could see what was going on with the mirror, and also using an ultrasound machine so she could see what was happening. And she came and saw me for her 6-week postnatal check, and she said, "Anna, thank you so much for going through that pushing technique with me, because when I had my epidural, I couldn't actually feel what was going on. But because I had practiced that technique with you beforehand, I felt confident knowing what I needed to do." So there is great benefit in understanding that technique before you do go into labour.
Everyone on the call, feel free to pop in if you are pregnant and sort of doing your own birth plan at the moment. If it's baby number 1, 2, 3, 4, whichever one that you've sort of got going on. Anna, around the table over a glass of wine, all of the women that I know want to know things like, am I gonna poop in the middle of my labour? Is that something that definitely happens?
Probably, to be honest with you. Baby's head and then body will put a fair bit of pressure onto your rectum as it's moving down through the birth canal. But your antenatal team, the midwives, are incredible, and this is their bread and butter, dealing with this bladder, bowels, vaginas, everything in between. So it's not even mentioned. You probably won't even realize that it's happening. So that should be the last thing on your mind that you need to worry about. You shouldn't lose sleep about it in the lead up to your labour, that's for sure.
I think it's really amazing what we hear and how we equate that in a time when you're not having a baby as to when you're in that birthing suite, and what is about to happen just totally takes over.
Yeah, 100%.
Right. And all of those things don't sort of matter as much as they do before or after.
Yeah, they don't matter. You're in your own little bubble, your own little world, very hyper-focused as to what's happening, and all the other things that you might have been embarrassed about before go out the window completely, because in not very long, you get to meet this little person you've been waiting so long to meet. Yeah.
Anna, in the big scheme of the planning around baby and the practicalities of bringing a child into this world that we all deal with, can you give us, what is your thing that you want expectant mothers to know about this process, about the labouring and the birthing process?
I think I want you to know that information and education is power in the birth space. We want you to feel confident and informed in the lead up to your delivery and then during that process, so that you can be an active participant throughout your birth, work with and be an active member within that birthing. You're the person who's birthing, but with your obstetrician and your midwives, so that you can have an effect on what sort of birth you have. Because we know that women who are informed and educated and who have more information tend to be more satisfied with their birth and their birth outcomes. So learn as much as you can. Surround yourself by health professionals who make you feel empowered and confident and excited throughout this process, because there is so much to learn. And if you haven't done this before, then sometimes it can feel a little bit overwhelming. So surround yourself with a team of people that you trust, and know that they can help you throughout your pregnancy, during that birth, and then throughout the postnatal period as well, when you're learning to become a mum as well.
I always find it really interesting, the stories that we hear about birthing. You know, you get to hear the top and the bottom of everything went to plan or nothing went to plan. And I'm keen to understand what does it look like, preparation with a physiotherapist? Do I have to come and see a therapist a dozen times before birthing? You know, what is the process of learning and understanding?
Yeah. Ideally, we would love to see you even before you were pregnant. We would touch base then when you're around at the end of that first trimester, around 20 weeks, around 30 weeks, 32, 34, 36 weeks pregnant. So that would be a great touch points, because there's different things that we focus on in different parts of your pregnancy. If that wasn't possible and you were managing okay, you didn't have too many aches or pains or concerns regarding bladder or bowel control, then we would definitely want to see you around that 32, 34 week mark in your pregnancy, so we can help you prepare for your delivery and then help you understand how we would be involved in that postnatal period as well.
Anna, just a quick question from someone on the call. How many sessions should people plan with? Is it enough or more?
Sorry, Sharlene, I only got the first part of that question.
Oh, sorry. How many sessions with your partner do you recommend?
Great question. If they can come in for one of your appointments, usually around the 34, 36 week mark, great. Often we'll get you to come in, if we haven't met you before throughout your pregnancy, come in just yourself, and we have lots to go through, and then we will make a plan as to a date that works best for you and your partner to come back into the clinic together so that we can practice all the different distraction techniques, labour positions, massage techniques, that kind of thing.
What are the questions from partners that you get?
What questions? I think, to be honest, partners don't ask lots of questions. I think they sit in the clinic room, they're sponges, they're just absorbing as much information as they can when they come in. But I do think they really like having some hands-on practice so that we get you out of the clinic room into our gym space, and we get you down on the floor in 4-point kneel and lunging positions. We get you practicing the partner. What position should their hands be in? And is it over the back? Is it over the pelvis? Where on the hips? What are some different massage techniques? How can I use a ball? And let's use a Swiss ball or a peanut ball. So I think not so much the questions, but they like being actively involved, and that hands-on approach makes them feel a little bit more confident in knowing how they can help at that time.
Hannah, so we're well informed. We give birth to a beautiful human being. What about afterwards? So what are the steps after I give birth?
So after you give birth, you will spend those early weeks resting, recovering, pottering around the house or your apartment, and then gradually out of your apartment, down the street, and then to the local coffee shop. And then over time, you will build endurance and filling up to doing a little bit more and more each day. So doesn't matter whether you've had a vaginal delivery or a cesarean. Your physio in your birth prep appointments will give you some different stretches and gentle movement patterns and information about how to start working your core and your pelvic floor muscles in those early weeks. If you're having trouble, aches, pains, concerns regarding bladder or bowel control, then we would see you in those early weeks postpartum. You're more than welcome to come into the clinic, or if you're having any issues with blocked ducts or mastitis, we want you in quickly. Otherwise, a lot of women will come in for what they consider their postpartum physio check. So that's around 4 to 6 weeks postnatal. And we look at a lot of things regarding pelvic floor function, abdominal wall function, movement through your back, through your pelvis, through your wrists, and then have a chat to you about what are your goals for the postpartum period. Are you someone who just wants to be able to walk along Bowen Road with a friend with baby in a pram? Or do you actually want to get back to High Rocks in 6 months' time? So we work out a plan that's individualized as to what is important to you. And just note that we look at things different to your obstetrician at that 6-week check. So we're more looking at muscular function through your abdominal wall and your pelvic floor. Your obstetrician, not as much.
I know different places in the world have different recommendations and allowances for women to go and see a physiotherapist, right? Quite famously in France, there's like half a dozen sessions that get paid for by the government. We'd all love to be doing that. Steph would like to know, and this doesn't surprise me at all coming from Steph, what is the typical timeline for getting back into exercises, particularly weight training for a vaginal versus a C-section delivery?
Yeah. Assuming things have gone to plan and your recovery is fairly straightforward, whether that's a vaginal delivery or a cesarean, we start you getting back to doing body weight movement patterns around 4 weeks postpartum. So that might be movement patterns such as a hinge pattern through your hips or a squat or a mini lunge. And then around 6 weeks postpartum, as long as your doctor's happy as well with your healing, with your wound healing, whether that's through your abdominal wall or your pelvic floor, then we can start adding some more resistance. So that might be bands, light weights, that kind of thing. And then we gradually build that up from 6 weeks to 12 weeks postpartum. And around the 3-month mark, women usually start to feel comfortable to ramp things up a little bit in terms of intensity and weights. And that is very much dependent on how well your tummy muscles are healing, what's the function, the strength, the tone of your pelvic floor, and other things such as your past medical history, whether you're breastfeeding or not, how much sleep you're getting. So lots of different factors. So while, yes, we can give you general information, and hopefully that's what you were after, we try and individualize it as much as possible.
So just coming to the end, so if anyone has any questions, please do jump on to ask Anna. Anna is a women's health physiotherapist at Joint Dynamics Evolve, who does birth preparation and postnatal physio, amongst so many other women's health things, but this is sort of what she does most days. At Joint Dynamics Evolve, we're trying to build a community where people feel empowered by the information that we provide. If you have questions that perhaps don't necessitate a visit, please reach out to the clinic, either through Instagram. We're going to email everyone who's on the call at the moment with Anna's details. She's happy to provide information for you. And of course, if you would like to come and speak to a physiotherapist in an appointment, then we'd be happy to help you out with that as well. Anna, did you want a last sign off to everyone that's on the call today?
I think that I want you to remember that for any other big life event, whether it was your wedding or buying a house, for instance, you do lots of prep. You go to view venues and all your dress fittings, or maybe you're researching the property market. The same applies for your birth. Big life event, prepare yourself, inform, engage with health providers, feel confident and empowered for this really exciting time. We really want to help you and be involved.
Amazing. Thank you so much, everyone, for being part of the call. We are going to be running lunch and learns on a monthly basis. The topics will vary. Certainly pre and postnatal will be a big part of what we're doing, but also all of the women's health topics that we cover in Evolve. We're going to have experts speaking on a monthly basis. Next month, our psychologist, Catherine Gale, will be on talking to us. So yeah, so we're so excited to start this series and hope that you guys will be joining us in the lead up. For those of you preparing for birth, our thoughts, love and wishes are with you. And if we can help in any way, please do let us know.
Thanks, everyone. And we'll keep you updated for the different times and topics for the lunches and learns through our social media and through our newsletters as well.
Yeah, just follow us on Instagram. That's at Joint Dynamics Evolve. And yeah, we look forward to seeing you again soon. Thanks so much, Anna.
Thank you. Bye, everyone. Thanks, Sharlene.
No worries. I'm just going to stop us recording.